The fellows you see near me, they are all students. We are students of Geneva University, but currently based at Inzon, Kakuma.
So we came into the community concerning the works that was given by the visual exchange members.
We are doing an activity for the class, and as a requirement, we were told to get the pictures and also the audio of a community member, the picture that portrays a health concern from Kakuma refugee camp, and they came to realize that there is poor waste disposal. For real, it has a negative impact to the community, because it's not relevant for people to live where it's overcrowded. So this is really effective, because you find in a household a building is built close to the latrine, and also a kitchen built close to the toilet, because due to the lack of space, because there is no enough space that one can separate the house from the toilet, and also the toilet from the kitchen. So this is really effective, because for an instance, if someone is cooking in the kitchen, and it's obvious the flies from the toilet will come into the kitchen, and this will affect the food that was uncovered, and once it's eaten, it will lead to cholera infection. So in a household, you find someone digging a dumping site, because there is no enough space for someone to go outside there and throw the waste there.
I see a lot of dumping, the offals, the cow dung, the horns, the bones, all stuff just are heaped here. Do you see there is any problem that is really challenging in terms of waste management?
We are seriously facing hard challenge concerning disposing of these materials, the manure, the offals and everything, and we are currently going through some situation that might lead us into several diseases ahead.
When it rains, for sure, the waste that was thrown there will bring about a bad smell, and also it also bring other infectious diseases, and also it becomes a breeding site for mosquito that leads to malaria.
Me, myself, or as students, we have found you burning this rubbish. Are you doing a volunteer work, or you have been paid for this work?
I've been doing volunteer work.
Okay, that's good. In short, you are one of the ambassadors of hygiene within the camp.
So the smoke from the burning trashes, it's really affect. Like there are some people who are sick, like they have problems, and this smoke affects with the respiratory systems. So this causes sometimes death when you are sick, asthmatic, and you are inhale this dirty smoke, and there's no inhaler near you. This can cause even a death of a person. So this is really a challenge, and it's really affecting us.
So I wanted to know if you have ever experienced this in community, like you have said there are some people who are sick, like they have asthma infections, and when they inhaled that smoke from the community.
Yeah, we have ever experienced that in the year 2019. So there was a pregnant woman that faced that challenge. So there was a neighbor that was burning those trashes around the block, and so the woman was inside sleeping, and so at that moment she started fainting and she was shouting, and it was a challenge for us, and there was no one who was around her. So if she wasn't around, like if the children were not around, so that woman would have been dead by now. So we managed to carry her to the hospital. So and she was at least feeling better. So and there's no any place that is near an open field where we can trash our dustbins, and we put our trashes there. So it's really affecting us. It's really a challenge to us.
When I was moving around today with my team, we had to meet one person, and he said illiteracy and ignorance is one of the causes. Is it true on your side? You find people there?
On my side, I think it could be true.
Yes.
Because not all of us who are here in the camp that maybe that we went to school.
Okay.
You find it very hard, so because we are so different countries, different
nationalities
in the camp. For example, Sudanese, Ugandans, Congolese. So you find it that most people, they are illiterate, they never went to school.
Okay.
And for them, it's so easy for them to dump garbage everywhere. They even at the back of their minds, they don't know that maybe it can even cause diseases.
So they are doing that because they also don't have a place where they can dispose of that material. In case like they are done with using that material, they are like, where can we dispose this stuff? Where can we take this stuff? There are several things that we can do, but we shall also require intervention of other organizations.
Maybe the government and our community leaders, mostly the community leaders, to talk to the upper people who are concerned, maybe to get one gazetted area, maybe in each community or in each block, whereby they gazette one area where the garbage is supposed to be dumped, not everywhere.
I would like to call upon community leaders in coordination with other organizations and maybe even the police to help on sensitization and mobilization of the community members to create awareness about proper garbage disposal.